We also have vocal folds, which you've probably heard of before. Another word for them is vocal cords. We have a false and a true vocal cord. False is what is sitting on top, so it is the most superior vocal cord, and all it's doing is just supporting the true vocal cord. A couple of other names for the false vocal cord, you'll see ventricular fold, or you may see vestibular fold. The true vocal cord, which sits below the false again, this is what is physically moving as sound is produced. So they slam shut and almost vibrate depending on the noise that is being made as air is expelled up from the trachea. We also have the glottis, which is not a physical structure, but a space. This is the space between the left and the right true vocal cords, and this will either get bigger or smaller depending on what the true vocal cords are doing. Now, there's actually a pretty cool video you can find on YouTube of Steven Tyler, who is the lead singer of Aerosmith. There's a video where his doctor actually puts a camera down his throat, and you can see his vocal cords moving as he sings in different notes. So you can just look up Steven Tyler vocal cords if you want to watch that on YouTube. It's a pretty cool video to show you how these are actually working. We also have the epiglottis. Now, this is a little fold of cartilage that sits just above the trachea, and it's going to help try to solve a problem that our body can run into sometimes. So, air that we breathe in either through our nose or our mouth will travel through our throat or pharynx, and food we eat will also travel that same path before they go down their separate tubes. Now, we don't want our food to go down our trachea as it will block the airflow getting into our lungs, and that's actually what we call an airway obstruction. So the epiglottis is actually going to fall over on top of the trachea, and it's going to try to prevent food from entering the respiratory tract and prevent an airway obstruction. So here's the epiglottis right here. So sitting just above there. So we're looking from a superior view here. We see our vestibular or false vocal cord right here supporting the true vocal cords, which are in white in this picture. And then we see the glottis, this space between them. So as noise is produced, they will slam shut here and close the glottis. This is a picture where we can kind of see the internal view of all of this structure here. So our false vocal cord right here is going to be sitting on top, whereas our true vocal cord sits right here on bottom. And then here's a picture of the epiglottis right here. So here's the tube over here on the right that will lead down to the esophagus. If we continue down this other tube here where the vocal cords are contained here, this will lead down to the trachea, which will eventually get into the lungs. We see just a little outline of the tongue up here, so close to the mouth. So as food travels down here, this epiglottis will kind of close off and try to seal the airway from food. We have a couple of veins we also got to do here, these big veins. We have the superior vena cava. Now, this is actually going to drain blood from both of your arms and your head, and it's going to drop the blood off into the right atrium, which we'll get into in a different lecture. We also have the brachiocephalic veins. Now, brachiocephalic, if we were to break that down, means arm, head. So these will come together making a V shape, and they actually form the superior vena cava here. Now, each brachiocephalic will also be formed by two other veins. Our first one, called the internal jugular vein. So this will actually be draining blood from the brain, from the internal structures of the head. And then we also have the subclavian vein. Now, the subclavian vein is actually the exact same vessel as the axillary vein, which we learned last time. So the axillary vein will turn into the subclavian vein, which will meet up with the internal jugular vein and form brachiocephalic veins, arm head. Now, brachiocephalic veins, the left and the right, will also come together and form the superior vena cava. And again, here's superior vena cava, and there are those brachiocephalic veins right there.